My brother, how are you, bro?
How you doing, my bro? Good to
I'm
see you,
good,
man. Good to
man.
see
Good to
you,
see you,
bro.
my bro. Good to see you. Always positive, always fresh, handsome. Nothing changes.
Thank you, bro. Thank you,
Yeah.
man.
My bro, how is the life?
Honestly, bro, like life is so different now.
Okay.
Like I said to my friend the other day, bro. I said like, 3 inches might as well be 10 to a short man. Do you know what I mean, bro? Like
Yeah.
I've grown taller. It's helped like my mindset. I think before where I was maybe overcompensating with like weightlifting and other ways, to sort of feel my presence, So like now, yeah, bro, I'm happy with my height. I went out to a club yesterday and like I'm seeing people that's like my old height and
Uh-huh.
like these guys, I can see like the top of their heads. Do you know what I mean? And it's like,
Wow.
yeah, I could tell like you're my old height because you're trying to walk so strong and so tall, and there's only so high that you'll go. Do you know what I mean? And it's like, yeah, I think yeah,
Yeah, yeah.
yeah, I believe yeah, yeah,
The goal was 10 with the lawn, the femur on the femur, but you reached 7.5.
yes, exactly,
What was
yeah,
the
yeah,
reason
yeah.
why you couldn't reach 10, by the way?
The reason that I didn't reach 10 was because my pin on my right leg started to bend. And it started to create like a wound, and the wound got bigger. And at that point, I'm looking at the wound, and it's like, come on, realistically, it's infected now as well. You just got to stop. You just got to be happy with what you have, and just put a stop to it. Like I didn't even know you could grow a millimeter taller, bro. Let alone 10 or 7 or whatever. Like, thank you for the opportunity that you gave to me. Yeah.
I will love to know how was the reaction of your family, of your friend, of your wonderful kids. Like, can you tell me more? Because I know that. I mean, I knew the feeling as a former patient who did three limb lengthenings done, but everybody's different. Every story is different. That's the reason why. How was your experience, bro?
Do you know what? I think the best experience was with my brother because he was way taller than me, and we worked together. He's my apprentice, so we see each other every day. So it's like when I went to my dad's house, I've got to step up on a step to get into the house. So when I stepped up, I was like, "Oh, but you ain't got your shoes on," and he was like, "Yeah, I have," and I was like, "Shit," because it's like, he's still up here, but I'm here, but it's like the eye level. It's like it's so close now. Yeah, it's made a big difference. I think with my brother, that was like a really changing point for me realizing it. But there's still loads of people I haven't seen. Me and my dad was the same height, and now I can see like the top of his head, so I can see all of him. Do you know? which,
Bro,
which
that
is
was one picture you sent me. It was your brother?
yeah, when we was outside. Yeah, yeah, yeah.
Wow, wow. I
Yeah,
mean, you can see the difference like really significantly, bro. It's amazing. I was shocked. I didn't know that it was your brother.
yeah, yeah. That's my little brother.
And bro, you remember you told me like my fate changed also with the surgery. It's not only the 7.5 what I gained, it's also my fate changed. So what exactly changed in your fate?
What I've noticed is that I think a lot clearer now. Like things are very direct. Like if I decide to go and do something, I don't really question it. Like I feel like I just make better decisions now. Maybe because there's less worry, there's more headspace for me now. Now I'm confident and proud of myself and my height now. Maybe subconsciously I didn't think I was good enough, so I was always overcompensating. For the height. I want to have the presence.
Yeah, yeah, yeah.
But yeah, I mean, I just feel like I make better decisions now, to be honest, and I probably dress maybe a bit more classier, whereas before it'd always be tracksuits and stuff. Now it's like jumper and
You're taller than before. You are looking different than before. Your proportion is much better than before. Your mental health is there, like mentally you are healthy. As you said, you can make better decisions. This bro, you touch all the points which I in the same opinion because I had the same problems. Because bro, I mean, yeah, your starting height was short, but my starting height, bro, was in a
It
different level.
super short.
Yeah,
That's super short.
yeah,
So you went from super short, past short, to like a mid man.
yeah. So,
Yeah.
and as you can imagine, if people are asking me, Sedat, do you recommend the limb lengthening surgery? Bro, it changed me. It changed me. Now I
Yeah.
want to ask you, do you recommend the surgery, bro?
Oh yes, most definitely. I definitely recommend the surgery. I think like when you get to LLT, I think the trouble is it's like when you're short and you even get to LLT, you got the fixators on, you still don't believe it. Because you just think to yourself, no, like I gotta try it. I gotta turn it a bit more. I gotta do this. I gotta do that. I think if I was to do it again, I probably would have taken a bit more of a slower pace. But I enjoyed my time in Istanbul. Honestly, I really enjoyed my time. There's still people there that I still communicate with and connect with. I mean, that's the difference with LOT. You can either stay in your room, you can stay focused and do your own thing, or you can come downstairs and be social. You can be part of the gym squad. There's lots of different things, but yeah, I would recommend it, especially for people that are like say like 5'6" and under. You're really gonna benefit. I mean, if you're 5'7", you put on 4 inches, you're 5'11". That's a big change for someone that's like my height. Like I was 5'4.5". You're never really quite tall. You're always a little bit under the cuff. So to go from like that all the way up to like 170, it's a difference for me, bro. Especially, I think the weird thing is being taller than people that you were shorter than. They don't like it.
Yeah, that's true.
Yeah, because it's like they feel like they've accomplished you already, and now you come back and you're taller. It's like, no, not in my mind. I'm taller than you. So that's how you kind of rewrite things. You rewrite your fate and stuff. That's what I believe anyway. I believe I've increased my longevity and my luck
Yeah.
and I think even like with intuition as well. I think you get a better intuition on things. Being taller. Yeah, I think it's giving me more mind space.
Okay.
That's what it is. So I can have a better perspective on things overall. That's what I would say.
What do you think about tall peoples, bro? I mean, imagine a person is tall, already tall, so taller than Dr. Halil, taller than me, and he wants to get more taller. Like, what is your opinion as a former patient who knew everything about limb lengthening surgery, who did it, who is still in the recovery phase? What is your opinion, bro?
My opinion is that I kind of did this because I was sort of below average. I was short. I had not quite a disability, but the missing part to the puzzle. Do you know what I mean?
Exactly.
So it's like for me, that was almost a necessity because I've gone from being short to now being like a mid man, where it's like I'm not short no more. Do you know what I mean? I'm people might not say that I'm tall. Yeah, people shorter than me will probably think that, but general people would just think you're just an average kind of guy. So I feel lucky that I've come out of there with my health. Um, I do feel like I needed it. If I was like 6 foot plus, I shouldn't be really worrying about height. I think the reason that we worry about things is because we don't feel right about them. There's some sort of a strain or there's some sort of worry. But if I was 6 foot plus, I don't think I would need to have done that. I think people would really question me a bit more. Because a lot of people were a bit dubious about me doing it. Like, what about your health? Things like that. So it's like if I was already 6 foot, you know, I don't know if I would do it because I think there'd be other things in my life that I'm thinking about. Also, I'd be very, thankful that I did have height and it wasn't a problem because I think if you're 6 foot, it's more of like a luxury for you to be tall rather than for you to fit in like a band to say like you're an average height. Do you know what I mean? Because you're already past an average height. You kind of tall. I mean, each to their own. Do you know what I mean? People want to get all tattoos on their face because they feel it's more reassuring for them to have their name on their head or something. But for me, I felt like it was needed and it has made a difference. I wouldn't really tempt my fate. If I was already 6 foot, I'd think to myself, like, I'm just blessed with what I got. What if there's a complication and you ain't got this sensation in your legs anymore because of this? Do you know what I mean? Like, you already kind of got what you're shopping for. Do you know what I mean? So yeah, I think if you really got height, then it's very much a luxury for you because I think shorter people suffer mentally with their height, with being short. So maybe it's a mental thing as well. Maybe if you are 6 foot, you can still feel short. Maybe you come from a family where everybody is a lot taller than you, and you're the smallest. So okay, yes, then you might want to do it. There's a one-off cases like that, but I think if I was healthy, and I had my height already, yeah, there'd be other things. There probably would be other things that I would be focusing on.
I mean, you are telling me, bro, I need the surgery because I was short and it was for me a medical reasons to being normal now. That was the same for me. But people who's already tall want to get taller is just they want and they need attention. So, and this is not a medical issue, right? That's what you are talking about.
Yes, because the thing is as well, you're putting strain on your body. So if you're gonna do like the long method or precise in your femurs and then do your tibias, I don't know, man. Just be happy that you have height and that you're healthy. There's other things to do in life. But if you really feel like you need to do this, then do it for yourself. But again, this is about health. It is definitely about health. It's how healthy you come into lengthening. Is how healthy you'll be going out. Guys, really take your time when you are thinking about doing this procedure. It's not easy. I might be smiling and happy and stuff like that, but
Course.
you
To
know,
be
th-
mentally also really, really strong and ready, bro. It's not only sort of big, bro. You know that we was talking since I don't know 2 years, 1 year. I don't know the exact time. So
January 2024. Yeah.
exactly. Yeah, yeah, yeah. It's exactly, bro. You ask me a lot of question. I text you back and you prepare you also, and then you came and you did the surgery and guys, which I love with my brother Cartel, so he's really strong and he's a positive guy and he's really focused on his goal and that what he want to reach and bro that's the reason why you had such a great time. Of course, the pin bending, it's a problem, mechanical faults, complications. I'm not talking about that. That can, of course, happen with everybody. But I mean, even with that, you did like clearly decisions, which I really appreciated. And yeah, but anyway, bro, I mean, this is a goal at the end of the day, so which change you. But of course, this is not easy to reach that what you want until that to reach what you want. For example, there is a topic which nobody's talking about. It's a complication, for example. So, and now my question to you. As a former patient, you saw a lot of things, a lot of patients. What would you say to the patients who is interested in limb lengthening or who's doing currently the limb lengthening with Livelifetaller or other places about complication, bro? What can you say about that topic as a former patient?
If you are going to do limb lengthening, take it one step at a time. I know some guys have been very ingenious and they've created spreadsheets. So day one, they're at this height, and if they turn 4 times a day, they're going to be to this height. So in a week's time, they know how tall they're going to be. Amazing. I wish I thought of something like that. Yeah. Because then as well, you don't rush the lengthening because some guys, they'll come in, they'll lengthen, turn in their key for like a month, and then, they want to speed it up and they start doing 5, 6 plus times. Do you know what I mean? And, you know, sometimes you can make your recovery harder because you're doing the lengthening so fast, and then you get the fixators removed. And then you have to do all of the recovery, all of the physio to undo all of those knots that you put in, lengthening and getting taller. So I think, the smoother your lengthening is, the smoother your recovery will be. It's hard because you just wanna be like the Precise guys and do 2 mil a day, and see your height like really go quick. Um, but the thing is, you will get your height at the end of it. Extend your stay if you need to extend your stay. Plan it a bit more, but just do your 1 mil a day. That's all my advice would be. You definitely want to be in your physio. If you're gonna get the lawn, potentially you can get infection. Um, so you have to be on top of the nurses doing the bandage changing. Um, I mean, if you can get them to do a wet bandage when they do bandage it up, if they have to use antibiotics, ask them to inject it inside of the wound. I didn't really get much nerve pain, so I can't really speak on the nerve pain. But I have heard that if you use ice, it's better for nerve pain than heat.
Ice and vitamins also, by the way. There's some different
Yeah,
vitamins which helps really for nerve pain. Yeah.
yeah. I've heard,
I had it also, bro. It was.
yeah. So you probably know better than me. I mean, I had a load of magnesium, but I like to eat greens anyway, so it's quite good for your muscles to have the greens and stuff. Yeah, the heat is more for your muscles and the cold for the nerve pain. Keep up with your stretching. I would say if you were to do this the elite way, you would stretch every time before you lengthen. And that's 4 times a day. That is a lot of lengthening. You can have complications. Luckily, I only had that one thing really with the pin bending my wound becoming bigger. I looked at it, and from my perspective, it I was like, okay, if you have to remove it, you have to remove it.
But bro, you have to add something here, very important. I mean, for example, you was a type of patient who was listening, so like who was say, hey, thank you, doc, so like thank you for your recommendation. You are the doctor, you know better than me. I trust you and I trust you guys. So okay, if you need to remove because so my health it's important, because if you would not remove, I remember Dr. Ali's word, hey, cartel, so then they will cut more your skin and you can have some infection risk, because imagine your skin is under tension. And if you lengthen more and more and more, even in that situation, of course, there's a risk in your case because your body is different. But my brother, also other patients who unfortunately not listen and who even refuse the treatment and say no, so I want this and do also this, please, I want to refuse the treatment. And of course then problem and complication happen. And then the patient should be not have the reason to be shocked and say why such a problem happened because you don't listen. I mean, you are a type of patient, for example, who really was like ready to listen and follow the instruction. That's the reason why even with that issue right now you are doing good, right? So thanks God we also not have infection or something like that.
My CPR was 6.15 when I left, so it was really low, um,
Thanks God. Yeah.
which is good. Yeah, yeah, just ideal to be that low. You have to listen to the doctors. I mean, it was Dr. Halil's advice to get the fixators removed. It wasn't even the medical team in LLT. They relayed the information, but that was his decision. And you, I have to listen to him. This is his job. He does it day in, day out. If he says something and sees it, that's what it's got to be.
My brother, there's also another topic which I was working on it since 6, 7 years. I don't know. Unfortunately, still today is a lot of people talking about that. If you do the limb lengthening surgery, you are disabled. You can never walk again. You can never go back to your normal life. Yes, you are tall, but unfortunately, you are disabled or you are crippled or you are handicapped. Uh, Something like this kind of topic. So, bro, I mean, when was the removal, by the way? Since when you are back in your home?
So the removal was the 4th of December.
Okay, it's not that much, right? It's like we have January.
No, it's not that, bro. It's not long at all.
What will you will say about that topic, bro? I mean, you saw also a lot of patients, and also, by the way, you saw our patient who came for an ear removal. Maybe you remember. What you can say about this topic, bro?
If you was to historically record your lengthening process and you was to do a daily diary of, the activities, what you ate, what supplements you did, it would hold a lot of information that would tell you about that patient. And then if you would have two patients, one that had a very good recovery and one that had a very bad recovery, if you was to study their health and what they've been eating and the activities they've been doing and the supplements they've been taking, I'm sure they'd be very different. A lot of the recovery process is due to the lengthening process. Like I said, how healthy you are in that state of lengthening will determine how healthy you are when you get your removal. If you've been eating loads of sugar and loads of junk food and you're not really stretching, you're not really having your supplements, you're having days where you don't really eat properly, your muscles are not repairing themselves and they're not in a good condition. So why would you expect them to be strong and to be in a good condition when you get them removed? Whereas the other guy, he's been training, eating, taking supplements before he's come to LLT. Now he's at LLT, he's gone to another level, another elite level of eating good, sleeping good, taking supplements, going to physiotherapies. Sometimes I would have 3 physios in one day. A lot of my recovery is due to the journey that I took myself on. Going to the gym all the time. These guys that I've seen in LLT, that are not in good condition. Do you know what? I never see them in the gym. I see them, in the lobby. They might be eating some pizza or just talking, just doing nothing. For me personally, you have given me an opportunity. Yeah? I have to take full advantage of this. I cannot be on my back foot, sitting back, just thinking like, oh, do you know what? I'm here. So everything's gonna go smoothly. I'm gonna be taller. My recovery is gonna be all perfect. No, don't get it in your head. There's a beautiful facility there, but you still have to take yourself to it, and you still have to do a lot of work. Don't just think because you've paid X amount for your fixators, they're just gonna make you taller and everything's gonna be perfect. It's not like that at all. You have to work hard to become taller. And you have to work even harder afterwards when you get your removal. Like I have a lot of hot baths. I stretch in the morning. I've got two physiotherapists. One is a Thai masseuse, and another one does massage, but they are also a chiropractor. That's it. They do the chiropractic. you know. There's Pilates that I'm gonna take up as well. there's a lot of things I need to dig deep in, and I need to do. And I'm not just gonna. It's not gonna be easy peasy walk in the park. People that you see that are winners and the champions, you know, they're people that work hard when other people ain't.
But bro, you open a really interesting topic. Why this kind of patients who's eating pizza, talking, who never see you in gym in the center, in the LLT center I'm talking about now for in our case, why this kind of people is complain, but like such a people is you not.
So you got two types of people. You got sayers and doers. The sayers are the lazy ones. The doers are the hard workers. They're the winners. And you know what type of person that you are. Yeah. If your recovery is very slow, you're having lots of problems, it's just an endless cycle. Like if you go to the gym, make yourself hungry, you're gonna give yourself an appetite, yeah? And then you're gonna eat some good food, which is gonna recover you. Yeah. So then you'll be able to go and, do your exercises or your daily routines. After you feel a couple aches and pains, then you go to your physio for your recovery. Then you eat to replenish, then you do your training again. And then you live like your normal life, and then you got your aches and pains, you go to your physio. You have to maintain yourself. It's basically looking after yourself on a deeper level. Can you look after yourself?
You know, you did the Lon method on your femur. So can you imagine that to do the surgery and go home under the care of your mom or of your friends? Can you imagine that? Is it like, should limb lengthening surgery really needs aftercare, bro?
Yeah, I mean, if you're doing a lawn method, you're gonna need 3 months to lengthen, and you may need a month for recovery in LLT. But then after your month, when you come back home, I think people when they come home, they realize how much LLT had like supported them, you know, because you got a gym in the basement. You just go in the elevator, you go down, you got your gym there. You got food that will come to your room. You got people that will wash your clothes and clean your room. All you need to do, and then you got physio in the building as well, which is a big thing. You can go to physio on a full floor. Do you know what I mean? It's not a secret. All these things are there. So, you've got all of those things. But I think what it is that after a while, people want to go back to their normal surroundings and their normal settings and things like that. People get homesick. I think there is a time where, you need to depart, go home. But I think before people come to LLT, they need to plan those 3 months ahead and break those 3 months down into weeks. Yeah, so the first 4 weeks, how are you going to be lengthening? Maybe you want to get the spreadsheet out, Maybe you want to talk to, the nutritionist and ask them, through my 3 months, how's my nutrition going to change? Do you know what I mean? What supplements will I need at the start, in the middle, and the end? There's all different types of things that you want to do. It's so interesting. Do you know what I mean? Like when you want to get your physios in, what type of physio you want to get? Alter G, you want to get the ice. Um, you want the laser on your legs, or you want the heat. Do you know what I mean? It's like all a variety of different therapies that you can choose from the physio. Yeah, and the recovery, the ice boots and things like that, to plan your recovery like that. But yeah, I think if you do want to come to LOT, there's a lot of things that people need to be coming with. You need to come with a clear mindset. Yeah. Potentially, you don't want to be overweight because it's gonna deter your mobility. It's just gonna be harder to get around. Do you know what I mean? If you're a bigger person, you got 20 pounds of belly or whatever, you're gonna be lengthening better. You'll be in a better condition if you take those 20 pounds off. Do you know what I mean? So what's your weight? Yeah, like don't be too skinny on the legs because you're gonna be lengthening them and they're gonna be stretching and stuff. So you want to be like just a healthy. You want to look like an athletic body. You want to look like an athlete. You don't want to look huge, like a big monster or nothing
Yeah.
like that. You know, there's no, you want to be too heavy. You want to look like an athlete, like a runner, athletic runner, not a long distance runner. There's, you know, you got financially as well. Do you know what I mean? Come here with the right finances. You know, ask a lot of questions. How much this gonna cost? That gonna cost? You know.
What is a good doctor for you, for example? There's also like a topic which is really important, like what like you want to do the surgery and you have to look for a good doctor. So what is a good doctor for you? I mean, how you can know the doctor is good, or what would be your priority for such a surgeries?
I think the way that I gauged LLT was off of you because you know you had done 3 surgeries with Dr. Halil, and it's like for me personally, I like that because I'm talking to the guy that's had 3 experiences that I'm gonna have an experience with, and you've had that experience with Dr. Halil. Do you know what I mean? That for me is everything. So it's like even my bodybuilding coach, you know, I've seen him grow from when he was nothing and he didn't have no abs. He had a belly. He even broke his leg, so he was pushed back a bit more. And now he's an elite bodybuilder. Do you know what I mean? So people that have their own experiences, they're the people that I'm attracted to because it's not necessarily the good things all the time, that you need to know about. It's the bad things, it's the problems. You're only gonna know about the problems if you've gone through something. Do you know what I mean? Like if you hadn't have gone through it, but you'd had 10,000 patients come through and you've seen everything that they've done, you know this and you know that and whatever. It's like, you know that secondhand. Do you know what I mean? You cannot say to a patient, you know what? I know what the nerve pain feels like in my quads. Like, this is the best solution for it. Do you know what I mean? You know straight offhand. So for me, Dr. Halley was a good bet, and you had reassured me that you had 3 surgeries.
People, I mean, lot of people is talking empty, like empty words. So, and I love it was always in my life like that, because if I'm in a right position, so I love to talk with facts, but if I know that I'm doing something wrong also in my private life, so I have two options. I will say I'm really sorry for it, or shut up, you know what I mean? So, and that's the reason why we are really proud to post our job also on the internet, because we know exactly, we don't have any reason to hide. For example, on your surgery, we know that we did everything right. I mean, your x-ray, everything is perfectly, how to put the nail and everything, and we knew that, and then because of that, we are proud of to share, no reason to hide, and also thank to you guys also, that you are ready to share your story, to helping other people's, and to show your happiness, and thankfully to live life taller. So, and I'm really happy, and I really appreciate it also, you take your time Sunday, your wonderful important time for me, bro, and to talk. I really appreciate it, my brother, by the way. Thank you so much. And what is the reason, bro, why you are helping me, why you are helping Live Life Taller to share your story to your wonderful, beautiful, handsome face? What is the reason, man?
Like I say, you've been consistent the whole way. This is, I don't know. I think the friendship, the relationship that we've built up is kind of effortless. So I don't feel like this time is being taken away from me. I feel like this is, quality time talking. Do you know what I mean? And if I can help people out there that want to do this, yeah, all you short kings and you short queens, if you want to do this, you know, this guy said that will give you an opportunity to be taller. You're obviously gonna financially have to pay for it. You're gonna have to, do all your research and stuff, but you will be able to get out of that negative mindset that you're short. I see people and I see that they're struggling with the height, especially more so now where I'm a bit taller. I see people in discomfort. And do you know what? That's just the people that I see. I'm sure there's other people that are behind closed doors and they probably don't get out as much or whatever because whatever reason they haven't got that little bit of confidence that I got, to push them to do the lengthening. I'm very thankful that I've got enough confidence and self-esteem and I can organize my life to actually do lengthening. So this video is for everybody that feels a certain type of way about their height and they want to do something about it. Get in touch with Sedat and have a consultation. It may change your life. I feel like it's made my life better. I'm living life taller.
Thank you so much, bro.
Yeah,
You know,
yeah,
also yesterday, bro, I was talking to a patient from Germany, and he told me, he asked me, why you guys posting patients and why other clinics they don't post it. I mean, bro, when I did the surgery, I did my own research. I couldn't see any before after picture, bro. I mean, because you have to do you have to want something. It's your dream, but you have to want to see also other stories. Say, is it really the case that you are getting tall? Or is it something just I have to pay money and that's it? You know what I mean? And unfortunately, on that time, which I want to get the surgery done, bro, I couldn't see any before after picture. And then I swear by myself and say, Sedat, if you want to make this as a business and help also other people's, like to make it professionally, so you have to share peoples who reach also the goal, because you have to show the peoples, because the people should believe really in limb lengthening. Because bro, even once I did the lengthening, even once I was with fixator, I couldn't believe that I will be get tall. I thought, hey, this is
yeah,
a dream, forget it, it's impossible.
yeah, yeah, yeah,
Yeah.
yeah.
And when I was asking to some doctors, hey, can I see before after pictures? No, because of the privacy. Hey, come on, bro. So it's not because of the privacy. I would understand if from 10 patients, 8 says privacy, but 2 patients is ready maybe to share, but the reason is you don't have enough patients. The second reason is there's no happy patients, you know what I mean? And you don't believe in yourself because you know exactly that you are doing something wrong with x-ray or surgery. That's the reason why you are not ready to post. And that was also the reason, bro. Hey, I want to make this as much as transparent as I can, you know what I mean? So to show people, say, guys, look, this is limb lengthening, it works. And yeah, also talk about your complication or talk about your experience. And of course, bro, limb lengthening surgery, it's not easy. I mean, if someone say, hey, it was one of the easiest thing in my life, I would say, hey, come on. I mean, this is not true what you are talking about. I mean, nose job, even a nose job, it's not easy. It's not painful, but your face is swollen for 1 week, and you couldn't see very well, and something like that. You couldn't sleep. I mean, everything is hard in a life, bro. You can make it easy once you said before, like, hey, stretch, eat very good, take your supplements, something like that.
Yeah, yeah, there's always solutions. There's always solutions to problems. And the thing is, what I like with LLT is there is always a solution. I found that with the patients that were there, there's a good ratio of patients throughout the 3 months. So they're in different stages. So you can go LLT and you're going to be in your first month. Somebody will be in the second, and another person will be in the third. And they're all doing different things. Some of them are doing long, some of them are doing precise, some of them are doing quadrilateral. Some of them are doing quadrilateral, long, and precise. Some of them are doing precise, precise. You know, so you get to learn, different things. The precise guy is talking about, I don't know, maybe nerve pain or something, and the long guy is talking about pin pain. Two different things. The precise guy is never going to get pin pain, so he's never going to understand that. But it's just a good variety, a good catalog of information, that you can get from previous, past, and present patients, which I think is good. There might be somebody, midway and they're talking about some growth hormone or something like that, and you're still at the start. You might go to your nutritionist and say, okay, what's this growth hormone? Do you know what I mean? What does it do? And, also testosterone as well. People can be prescribed with that as well. So yeah, I mean, it's a good bag of knowledge. But yeah, I mean, maybe one day you can have an A to Z list of, all of the problems and all of the solutions, you know. I think the solutions will just be, there'll just be so much things on solutions. Because if you've got a problem, it says muscle pain, you can say stretch, heat, exercise, physio, depending on where the muscle pain is. Is it in your quad muscle? Do you know what I mean? Is it in your hamstring? What is it? The inside, the top, the outside, the bottom? Whereabouts is your pain? Is it, the lower half by your knee? Is it up to your groin? Maybe you can have a picture, of a body, and then you touch it and you say, well, that's where my pain is there. Do you know what I mean? And you could be a certain amount of different medications, for muscle pain, muscle relaxation, nerve pain. I think LLT will grow, um, definitely grow as time goes on. But like what I said to you before, bro, it's like whenever you're doing well, you're always gonna have somebody who tries to take a stab at it. Sometimes that stab helps because it gets you to know where your weak spots are. And it's like, okay, you've taken a stab at something, you think you've got something, but you actually haven't. Do you know what I mean? So then you build yourself up again, and they can try and take a stab at it, and it's like, well, you're not getting in. Do you know what I mean? Because we got our armor on us now. And the thing is, it's like where you are very transparent is good. You have interviews with past patients, present patients, existing patients. You're going to have a very good catalog of problems and solutions, which I think is good. So yeah, just keep it up, keep growing LLT, and just try and retain all of these experiences. And sort the problems out and find solutions. Do you know what I mean? As you have been, and keep growing, bro. That's what I say, man.
I really appreciate it, my brother. Thank you so much, bro. Thank you. I mean, you are really such an amazing guy. I wish you the best, bro, for your life, for the future, because you earn always the best because you're a man with character, bro. You are really a really good guy with heart, with feelings. Bro, I forget to ask you one question, by the way. How is your recovery right now? I mean, how is your daily life? Because you told me like yesterday you went to disco, right?
Yeah, it's a party. I'm different. My personal journey may be different from somebody else's. I say I had my removal on the 4th of December, and I came back on the 17th of December. And then the 24th of December, that's when I first went out to work, actually. So 20 days after removal, I was up a ladder. I was working, with my son actually. I brought my son that day. After Christmas was after Christmas was done, I think like the second week in January, I went back to work. Yeah, I've been working since then. It's kind of a necessity that I had to go back to work because financially I needed to. So it's almost like pushed my recovery forward even more so, but that's my personal journey. I can't prescribe what I've done for anybody else. I can definitely help them, and talk to them and stuff, but my advice is impartial because I'm not an accredited doctor, but obviously I've done lengthening so I can tell you my story. It's not necessarily for anybody to actually follow themselves, but it's just advice.
Cartel was every day in the gym. He got twice, three times a day physiotherapy. I mean, when always I saw you in the lobby, he never sit I never seen you like sitting and watching TV, bro. He always moved. He always did something, and that's the reason why your journey is different. You are right, bro. But do you have right now restrictions, bro? Right? Of course, I don't think so that you can run right now because you need still time for running.
Yeah, I'm swimming at the moment, which is good. I mean, the only sort of pain that I'm sort of feeling at the moment is I have a pain in my right groin, and it goes from the groin over to the pins on the right side. But I mean, like that's the last of the pain, and I kind of get get physio to relieve me. But my restrictions, I would say I can walk down the stairs now without holding on to anything, but I just feels weird. It's like my legs need to just get used to it, and like they need to be a bit more flexible. I think my knee bending's good. I think it's probably my hips up here now. I think my knee, because my knees were really tight at the start. Like I could feel my IT band pulling in my knees. So I think all the tightness has just kind of gone up now, and that is the last of it, in the hips, sort of thing. Yeah, so run. Obviously, I can't run fast. Going down the stairs. Going down the stairs, I can go down the stairs, but it's just not very fluent. I can go up the stairs as well, but again, like with the right leg, sometimes when I push down on it, because it just goes into the actual hip joint, sometimes it hurts a bit. But I just got to do a bit of stretching. I mean, I've just got to work on my walking more, just to get it more fluent. But people say, "Oh, your walking's great, bro." Like, but for me, I want it to be finessed. Do you know what I mean? So just the stair. I would say the stairs and walking are the two things that are my challenges. And running, sorry, the stairs and running.
I had the same pain after my first surgery, like the growing pain, you know. I think so. My problem was I had the correction, you know, I had more legs 40-degree, bro. And to correct like such a
Mm.
oh, like to make it straight is everything changed, like the muscle tissue changed, the direction.
Everything. Yeah.
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 And
It's
and it's like you have to imagine, bro, right now the body is still sensitive, you know, because you lengthen a limb, which is impossible, like even to imagine. It's crazy, you know what I mean? For example, bro, my
yeah.
son is, Aras, my son Aras is 7 years old, and even last week he told me like, Dad, I have like, like knee pain, I have leg pain, and I told him, hey, my son, you are growing.
Yes.
So you are a human. And then I explained him, and then you know what he asked me? Dad, had the patient of Live Life Taller the same pain? I say yes, I had the same pain also, but the pain what I felt it was like worse than yours, and he wasn't happy. And yeah, I mean, it's a part of the process, bro. We have patients, they never, for example, sometimes I'm jealous, not I'm jealous, not like I'm like jealous. Like I say, hey, wow, it's crazy, man. Like this guy is really lucky. I mean, no pain. Now, for example, Power, Power, bro, you remember him, Power?
Yeah. Yeah.
Bro, he, for example, I talked to him yesterday, said that everything is like I never did the surgery. And I'm like, I mean, and when I imagine my journey was really hard, I suffer every second, bro, and still after that. Now, of course, I'm perfectly fine and everything. I'm really happy about it, but
Yeah.
is it how it is, bro? Like, and everybody's different. Just this is a temporary point. Don't worry about it. I mean, you will feel really good, and just give you your body the time. Before my surgery, I wasn't flexible. My hamstring was really, really tired, bro. Really tired. I mean, poo, it's like, even I remember my wife, she told me, hey babe, if you do the femur, I'm really afraid that your hamstring will be get more tighter and you will lose on your flexibility. And I was really zero, bro, zero. I was really zero flexible. And you know what, after all my three limb lengthening surgeries, I'm more flexible than before. You are the person who can make everything better, even the worst case, even the worst moment, you can do it better or not, because you are the boss of your body, bro. You decided which direction your body will go. You know, like if you decided to eat very unhealthy foods, to smoke, to drink alcohol as a water, you know, of course, bro, your body will be in a different condition. I'm not talking only for limb lengthening, right? But if you decided to, hey, I'm doing my gym, I'm taking care of my supplements, I'm taking care of my nutrition. Yes, smoking, no way. And you know, like this kind of things, bro. Of course, you will be much happier and different than a person whose lifestyle is different, you know. Bro, wait, I will show you my flexibility, like after all my limb lengthening surgeries, you know. Bro, because it's really, you know, my wife and a lot of people, they told me like, hey, you will be never flexible as before, and
Ah,
and something like that, you know. For example, but bro, before, you know,
mm.
I couldn't even do this, you know. It was like my limit, bro. It was like before my 3 limb lengthening surgeries. And look at this now. Of course, I'm like, I was just sitting for hours, but look now, bro.
Oh, yeah, that's good, bro.
You see? You see?
Very good. Yeah,
My
yeah.
hamstring, bro. To be honest, it was like before, it was like really, really, I was really stiff and bro, zero
Mm.
flexibility and something like that, you know? And yeah.
I can imagine with the bowed legs as well. It's
Yeah.
probably everything is in the wrong place. Do you know what I
Yeah.
mean? For you to be
Yeah.
flexible.
Yeah, exactly, exactly. Yeah, my brother, thank you so much. Thank you for your time, for your great, wonderful time. I really appreciate it, my brother. I'm so happy, so glad that you guys, yeah, give Live Life Taller the opportunity to can share the story because this is the best. How can I say? This is the best answer for people who's interested in limb-lengthening surgeries. You know, this is facts, bro. So we can show our job to peoples and not only just empty words. We can show the whole world, hey guys, we are doing the limb lengthening surgery, and yeah, this is the result. This is how the patient feel like, and this is the best opportunity for Live Life Taller. I really appreciate it, my brother. Thank you so much, bro. Thank you so much.
No worries, bro. No worries. You deserve it. You give me opportunity. I had to make something of it.
Much love.
That is it. Thank you.
Thank
Thank you, bro. You know, get yourself a plane ticket and just come down to LLT. That's better than anything on the internet. Come down yourself and have a look. Do you know what I mean? You see it for yourself. You see guys and girls with fixators on can talk to current patients. What's better than that? You got the man here that's done it 3 times over. Yeah, you got patients that's live in the rehab facility. If you could do all of that stuff, you're gonna be full of knowledge. And you'd be wiser, to make a better formal decision for yourself.
My bro, Cartel, I really appreciate it. Thank you so much, my brother. And happy to see your recovery videos and everything and stuff, my brother. Thank you, bro.
Yes, thank you, my bro, and yeah, I'll definitely send you some videos.
Thank you so much. Much love, my brother. Thank you. Thank you,
Yeah,
bro.
much love.